Hello and welcome. We're about to tackle a really important health topic, one that so many people deal with, but it's often kept in the dark. We're talking about painful intercourse, or what doctors call dyspareunia. Our goal today is to shed some light on this and bring some much needed clarity. And look, if this is something you're going through, the very first thing you need to hear is this: you are so far from alone. Seriously, some studies show that up to 22% of women report this experience. It's way more common than you think, and it's something that absolutely deserves to be understood. Because really, that's what pain is, right? It's a signal. It is not something you're just supposed to ignore or power through. It's your body's way of saying, hey, something over here needs attention. So the real question we need to ask is, what is that signal trying to tell you? So yeah, let's really lean into that idea. The whole message for today is that pain during intimacy isn't normal. It's not a given. It's something that needs a little investigation. So instead of seeing it as just this frustrating problem, let's start treating it like a clue. And you know what the biggest clue of all is? It's where it hurts. Seriously, just figuring out the location. Is it right at the entrance, or is it deeper inside? That is the absolute key that unlocks everything else. It's the first step to finding the real cause and, of course, the right solution. Now, to help us navigate all this, we're going to be drawing on the incredible expertise of Dr. Farzana Khan. She is a top specialist in this field, and her work provides this wonderfully clear, science-backed way of making sense of it all. And here's what makes Dr. Khan's perspective so powerful. Check this out. She's a specialist in both dermatology, so skin, and in gynecology, which is all about the internal structures. Now, why does that matter so much? Well, it means she gets the whole picture. She understands the delicate skin issues that can happen right at the surface, and she understands the complex problems that can start much deeper inside the pelvis. It's really the perfect combination of expertise for that. And this quote right here really sums up her whole philosophy. It's not about a doctor just telling you what's wrong. It's about you understanding your own body, setting realistic goals together, and being a real partner in your own healthcare. It's just a much more compassionate and effective way of doing things. Okay, so let's get to the heart of it. We're going to break down the two main types of this pain: superficial and deep. Genuinely, understanding the difference between these two is the key to everything that follows. All right, let's really look at this, because this is the big aha moment. On one side, we have superficial pain. Think about location. It's right at the vaginal opening. When does it happen? Immediately, right on entry. And the feeling? People often describe it as a burning, stinging, or even like a sharp paper cut sensation. Now, let's flip to the other side, deep pain. The location here is felt way inside the pelvis. It happens during deeper thrusting, not right away. And the sensation is totally different. It's more of a deep ache, cramping, or that feeling of something colliding inside. See, two completely different stories, pointing to two completely different sets of causes. So, if the pain is superficial, what might be causing it? Well, the causes are usually things happening right there at the entrance. It could be hormonal, like the dryness that comes with menopause. It could be a specific skin condition, like lichen sclerosis. Or it could be things like infections, scar tissue from childbirth, or even just really tight pelvic floor muscles right at that opening. Okay, but what if the pain is deep? Well, now we're looking at a whole different list of suspects. We're thinking about conditions that affect your internal organs, things like endometriosis, uterine fibroids, or ovarian cysts. It could also be from internal scar tissue, maybe from a past surgery, or even from conditions affecting your bladder or bowels that get aggravated during sex. Now here's where it gets a little more complex. It's not always just a physical thing. There's this incredibly powerful mind-body connection that can kick in and actually create a feedback loop that makes the pain worse. Let's talk about how that vicious cycle works. The main idea here is something called protective muscle guarding, and it's exactly what it sounds like. It's a reflex. When your brain thinks something is about to hurt, it automatically tells your muscles to tense up to protect you. It's kind of like how you might instinctively flinch before you get shot in the arm. It's the same principle. And this reflex is how you can get trapped. So here's how the cycle goes. First, you have an experience of pain. Your brain, being smart, remembers that. So the next time it anticipates pain before it even happens. In response, your pelvic floor muscles involuntarily tighten up, they guard. But of course, that muscle tension makes the entrance smaller and tighter, which then leads to, you guessed it, more pain. That just confirms to your brain that it was right to be scared, making it guard even more next time. And around it goes. So here's the good news. Understanding which type of pain you have isn't just for your own information, it's literally the roadmap that points you to the right kind of help. So let's see how knowing where it hurts translates into knowing what to do. Okay, so if you're experiencing that superficial entrance pain, that burning or stinging we talked about, the treatments are going to focus right there, on the surface. We're talking about things like topical estrogen for dryness, special steroid creams for skin conditions, or even seeing a dermatologist who really gets this stuff. On the other hand, if your pain is deep and internal, that aching, cramping feeling, the solutions logically are focused deeper inside. That means getting a proper medical workup for things like endometriosis or fibroids, working with a pelvic health physiotherapist, or even simple but super effective things like trying different sexual positions to find what's comfortable. And here is a super important point that applies across the board. Remember that protective muscle guarding we just talked about? That muscle tension can become a problem with both superficial and deep pain. And this is exactly why seeing a pelvic health physiotherapist can be such a game changer. These specialists are experts at helping you release that chronic, involuntary muscle tension, which can be the key to finally breaking that vicious cycle of pain. So if you take one thing away from all of this, let it be this: pain is not normal. Your pain is real, it's valid, and it's not something you just have to accept. By listening to your body and figuring out where it's trying to tell you the problem is, you unlock the secret to finding the right treatment. And that is the most powerful first step you can possibly take.